Hello, this is Optimum Health Solutions, and I'm your regular host, Dodiyi-Manuel. Today, we have members of the Nigerian Hypertension Society with us, and this is because the 17th of May every year is World Hypertension Day, and they are here to talk about hypertension and hypertension-related disorders. So I have with me, on my right, Dr. Bunmi Ajala. Dr. Ajala is a consultant physician cardiologist. Dr. Ajala, you're welcome.
Good day.
On my left, we have Dr. Dodiyi-Manuel. He's also a consultant physician and cardiologist. Dr. Dodiyi-Manuel, you're welcome.
Thank you, sir.
Last but not the least, in fact, the most important person here is the coordinator of this program, Dr. Edeogu. Julius Edeogu.
Thank you, Prof. Good afternoon, viewers.
Dr. Edeogu, you are welcome.
Thank you, sir.
So we go on straight to the point. What is hypertension? Why are we worried about hypertension? Why is it that every year we are reminded of this disease or disorder? We are going to hear about that from members of the Nigerian Hypertension Society. So we'll start with Dr. Edeogu. Why World Hypertension Day?
Yes, thank you very much, Prof. World Hypertension Day is actually celebrated every 17th May. It was first celebrated 2005. On the 14th of May, that was the first celebration, and it was organized by World Hypertension League. Subsequently, it comes up every 17th of May. The essence of this celebration is to create awareness about hypertension, its maintenance, and health-related issues caused by hypertension. This year's theme happens to be Know Your Numbers. And that's why we're here today as a way of advocacy. We're here with our mentor and our teacher, the Dean of Cardiology, South Nigeria, to have the roundtable chats team on hypertension. Thank you, sir.
Thank you very much. So we're going to talk about Know Your Numbers. What numbers are we talking about, Dr. Ajala?
Okay, so when we say know your numbers, we're actually talking about know what your blood pressure is. And since the blood pressure is depicted in numbers, what are the stake numbers that will tell you your blood pressure is okay? So hypertension is generally defined as the blood pressure that is greater than 140 systolic. That's the upper one for most of us that have taken our blood pressure before. And diastolic, that's the lower number. So you want your blood pressure to be less than 140/90. The optimal blood pressure will say is less than 120/80. People that have blood pressure between 130 to 140, 80 to 90 are referred to as pre-hypertensive, meaning that at this stage, you want to already try and do things that would not allow you to become hypertensive in terms of lifestyle modification, which we'll be talking more about. So the numbers are referred to your blood pressure. The systolic, the upper one, diastolic, the lower one, which we expect to be less than 140/90. Amen.
Okay, so whether somebody is pre-hypertensive or hypertensive, will need lifestyle modification.
Yeah.
Dr. Dodiyi-Manuel, what are these lifestyle modifications we are talking about?
Okay, when someone is pre-hypertensive or hypertensive, there is need for lifestyle changes because there are certain things that predispose one to hypertension. Taking of alcohol, smoking, not taking enough vegetables, and all. So these lifestyle changes are important in addition to taking your medications for those that are hypertensive. For instance, since we know that sedentary lifestyle can predispose to hypertension, you should start your exercise, take walks. You can start with just brisk walking, taking walks before you start thinking of jogging, preferably, even if it's not up to 15 minutes, 30 minutes, but it's advisable to do at least 30 to 30 minutes on most days of the week, meaning that you should do 30 minutes for about 5 days thereabout. And apart from that, you reduce your salt intake. It's been known that blacks are predisposed to salt-sensitive kind of hypertension. So just reducing the amount of salt you take is very important. When we talk of salt, there are some preservatives, there are some spices, Knorr cube, Maggi, and all that we use. They contain a lot of salt. So these things, reducing your salt will also help you, apart from the exercise. Taking vegetables and fruits increases your potassium and helps you to lose salt and water, and will also help you to reduce your blood pressure. Alcohol, reduction in alcohol, or even abstinence in some cases has been shown to improve hypertension. Smoking should be stopped, preferably. And most of these will help one, at least in addition to your medications when you're hypertensive, prevent you from becoming hypertensive or even improve your blood pressure control. Thank you, sir.
Thank you. So alcohol should be moderated.
Yes.
Or take alcohol in moderation.
Yes, sir.
While smoking should be stopped altogether. Now, there's always a question: what is moderate alcohol intake? Or what does it really mean to the layperson?
Okay, let me take that. Alcohol actually has a U shape when we talk of the
cause and effect.
It benefits, yes, cause and effects as far as the cardiovascular system is concerned. What that means is that people that don't take alcohol at all have some degree of risk for cardiovascular conditions, but people that take excess alcohol have high risk for cardiovascular diseases. Now, what is safe alcohol dose? Now, for men who are hypertensive, it is advised that you take 250 ml of beer per day. Okay, that is the safe dose for men. And then for women who are hypertensive, it is they should take
half of that.
Yes, about 8 grams rather, or half of that I mentioned. Now, but the problem here is that it is difficult for people to just go to the joint and then take just 250 ml of beer,
half a pint of beer,
half a pint of beer, and stop. There's that temptation of
continue.
I want to take more.
Yeah.
And for that reason, we advocate that it is better to abstain, especially when you already have cardiovascular issues.
Okay.
Now, for let's talk about this in terms of unit also, so that people will understand. Now, that's 250 ml of beer translates to 1 unit of alcohol. Now, for gin, 25 ml translates to 1 unit. Okay, so that's about that.
Wine.
Yeah, for wine. Yes, for wine, it is red wine actually. You have 125 ml that translates to 1 unit of alcohol. Okay, so that's about that.
So with all these calculations, sometimes I want to think, we have to start putting it on the scale or measure how much. I think it should be important that once you have cardiovascular disorders, don't take alcohol.
Yeah.
Just stay away.
Yes.
Stay away from alcohol. But it is, I think the point is that alcohol is not entirely out of the picture.
Please.
Just like we say that don't smoke. That one is definite.
Definitely.
For alcohol, we say reduce the quantity you are taking and in moderation.
Yes.
So thank you very much. So we then move on to the what we call epidemiology, which is who are these people? Who are the people that are likely to be hypertensive? What is the prevalence of hypertension, for example, in the general population?
Okay. So the prevalence of hypertension amongst us, studies have been done, local studies in Nigeria, and it has shown that 3 to 4 adults out of 10 adults are currently hypertensive. So if you put 10 adults together, at least 4 will be hypertensive. So that's how common it seems about it. And hypertension tends to be commoner in the blacks. Because of our race, our color, we have genetic predisposition to be hypertensive. So we tend to get hypertensive at a younger age. And then the complications of hypertension also start earlier amongst us. So there is our race there. Then hypertension is also common. The older you get, the likelihood that you would be hypertensive. So age, although, as we have said, with our race, hypertension starts earlier. So younger people can also develop hypertension.
So, the prevalence, those who are likely to get hypertension, what is how common is hypertension, for example? So, and we know that hypertension is silent killer. What it means is that usually it does not have any symptoms unless complications set in. So how do we now recognize hypertension in the general population or even in ourselves? How do we know that one is hypertensive now, or this person is hypertensive, the other person is not? How do we go about that, Dr. Dodiyi-Manuel?
So hypertension really, as Prof has said, is a silent killer. And really, most times, very few people have any symptoms at all. Symptoms are what the patient will tell you. So somebody can be walking and be moving around with a blood pressure of 300 over 160 and does not even know. So some people are lucky and they have warning signs. They may have headache, they may have dizziness, or they may just feel unwell or feel tired. But most times, there is nothing to show. So it's very important that we check our blood pressure, because like the pidgin English will say, they show for face. It does not show in anybody. So you just see someone looking very healthy, and that's why we have people collapsing like that. It's only when the complications come up that this person is hypertensive, like the person having stroke, for instance, one part of the body being paralyzed. Then they now realize the person is hypertensive, or has kidney problems. That's when they now realize, this person had already been hypertensive. So you have to, or heart attack or heart failure, leg swelling. At that point, the hypertension has already started causing problems in the person's body. But it's better if you pick it up early and check the blood pressure. That is why you screen for blood pressure. And that's one of the key things we are trying to sell today, that everybody should know your numbers. Check and know whether your blood pressure is really normal. Is it less than 120/80? Especially if you have a family history. Because once your parents or siblings or your brothers, sisters have been hypertensive, there is a risk that that person can also be hypertensive. So there's need to check your blood pressure. It's very important.
So, check your blood pressure. The general public should go to health facility and check their blood pressure. Are there any other ways of ensuring that people's blood pressures are checked, and then we'll now advise them as it were to go to a health facility for management?
Okay. Also, in checking your blood pressure, aside from going to a health facility and going to the hospital, I'm sure that sometimes some of us have blood pressure monitors at home, like the one that is here now. We could invest in a blood pressure monitor and keep in the house and check your blood pressure from time to time. That's one. But for people that cannot afford to do that, there are health centers around that you can walk into, even pharmacies that are around that you can walk into and check your blood pressure routinely. And if that helps you to know what your blood pressure is. And blood pressure has to be checked adequately. When you're checking your blood pressure, you're not expected to talk. You're expected to sit, your feet flat on the floor. Your back should be rested. You should at least have avoided taking things like caffeine or even a meal in the prior 30 minutes before you check your blood pressure. And this your blood pressure cup, which is what you wrap around your arm, must not be too small or too big for your arm. And then you should avoid talking while you're checking your blood pressure. And most importantly, the blood pressure should not be checked with your clothes on your body. You should place the cuff of the blood pressure on your bed. So which are the steps you should take in getting a correct blood pressure value. It's important to know that there are also different measures of checking your blood pressure. It can come to the hospital. For some people who find signs of hypertension, but when they check their blood pressure appears normal. So this set of people can be asked to do what we call an ambulatory blood pressure, where a blood pressure monitor is connected to your arm and you carry it around for 24 hours. And this helps to get your blood pressure reading every 30 minutes. And with that, you're able to get an average blood pressure reading all through the day. And it helps diagnose blood pressure better also for people that will have confusion. So those are one ways that we can check our blood pressure.
Fine. So we know once blood pressure is, hypertension is recognized, the thing is, what do we do next? Dr. Edeogu. So the person comes in, he's recognized of had hypertension. That's after having the blood pressure checked at least 3 consecutive times, and they are elevated, isn't it? Yes. And you also know that we don't just, for example, if my blood pressure is normal now, it may not be normal in 1 month's time. So keep checking. So there's continuous checking. So once you've confirmed that the patient is hypertensive, what do we do next?
Thank you, Prof. Once it is confirmed that someone has elevated blood pressure, having been checked on 2 or more occasions, as we just said, the next thing to do is, first of all, lifestyle modifications. That you do. But however, you also have to be sure that there are no complications, cardiovascular complications at that point in time before you start only lifestyle modification. If there is complication alongside, you need to start both lifestyle modification and medications. But for those that do not have complications, you start lifestyle modification for at least 3 months. If after 3 months, the blood pressure is still high, not controlled by lifestyle modification, there is need to add drugs to ensure that you achieve control. Now, there are also people that have high normal blood pressure. It's important to mention this. And if you have high normal blood pressure and there is complication, for instance, you have what we call heart enlargement, or you're already having what we call arrhythmias, the heart is beating beating abnormally. And then we do certain basic investigations like ECG that may confirm that yes, there is hypertensive complication ongoing. Such person will need medication in addition to lifestyle modifications. So
if the person comes with a blood pressure of 180,
very high.
Sure. I'm coming to that. So at that first instance also, if you catch a patient, the blood pressure for the first time, it is so high, maybe 160, 180 and above, you don't even wait for a few days to check again. We need to start something for that immediately. Otherwise, this patient will have immediate complication from such high number. So that could be done. Now, for people who are starting on medication, it doesn't preclude lifestyle modification. Both of them are started together. So that's what we do. Also, we know that currently drugs are quite expensive. Most patients are unable to afford their medications. So we emphasize that lifestyle modification, and then some other medications that are not as expensive as the generic ones can also be used. So provided you achieve the same aim at the end of the day. Okay, thank you, sir.
Thank you. So blood pressure needs to be high blood pressure needs to be controlled so that you have normal range or normal levels of blood pressure in order to avoid complications. What are these complications that we want to avoid?
Okay.
Dr. Dodiyi.
So, certain complications that can occur from hypertension, high blood pressure, are things like stroke. I know the laymen talk of partial stroke, but once there's weakness or any abnormality in part of your body and it lasts more than 24 hours, for us, it's a stroke. And apart from stroke, you can have heart attack, where somebody is called a myocardial infarction, but laymen say it's a heart attack. When there's sudden reduction in blood supply to the heart, the person will be holding the chest and all, and this can lead to sudden death in these people if nothing is done. The heart can also fail, and because the heart is a pump that's supposed to pump blood out of the body to different parts that will suggest heart failure. So they can have heart failure in these patients. Apart from that, as you had said earlier, you can have abnormal rhythm. The heart starts beating abnormally. All these abnormal rhythm can also lead to death. Even blindness, retinal detachment, a lot of things can happen. The blood pressure can be so high that it can even affect the big artery of the body called the aorta. So when it affects it like that, it can suddenly tear, rupture, and that's what we call an aortic aneurysm. So a lot of things, heart diseases, kidney diseases, blindness, a lot of things can occur just as a result of hypertension.
Okay, thank you. So that is why blood pressure should remain controlled. There are complications can occur, and they can occur suddenly. And they affect virtually every part of the body, wherever there's blood supply. Once the tension is high, anything can go wrong. So, who are the people that are likely to become hypertensive? For example, what factors will make somebody hypertensive? Is it just sedentary living, obesity, things like that? There are no other reasons why somebody can be hypertensive. Let's say two people, one is hypertensive, the other one is not. What factors are we talking about?
Thank you. So apart from this, in fact, genetic factors are very important. And when we are talking of hypertension, yes, we are all talking adult cardiology, but there are some, even children can be hypertensive, especially if they are low birth weight, because they are born with very small kidney structural function, that's the nephrons. So when it happens like that, their kidneys are already that's deranged, their kidney function is compromised, such that their kidney is working harder than that of someone their age. So if somebody is low birth weight or preterm, it already has put that person at risk. But genetic factors are important. Most times, what puts people at risk of hypertension sometimes is because it runs in families. When maybe the parents or siblings are hypertensive, there are various genetic things that put one person at risk. So where it runs in such families, it's necessary that every other person in that family already starts a lifestyle modification long before the time, because that person is already at risk. As you have said, the black race, even low social, sometimes even in our environment, people talk about fast food. When you eat and the child is obese and all that, you think you're doing the right thing. But however, that may not necessarily be beneficial. So what you eat matters a lot, because taking things with high cholesterol, trans fat and all would also predispose that person to hypertension. So that person that is, eating wrongly and not taking fruits, vegetables, not exercising and all, is more at risk than the other person who has a better lifestyle than the other.
Okay, so finally, we have said to treat hypertension, we may require lifestyle modification and drugs. Now, suppose these drugs, most of them are not made in Nigeria. They have to be imported, and they're subject to the variations in dollar rates and so on. Now, what happens when most of the drugs you use, best drug, for example, quote and unquote, are no longer affordable. Dr. Edeogu.
Yes, sir. Yes, it's really a big problem, Prof. The costs of living generally in Nigeria today is very, very biting. It's not pocket friendly at all. Most patients complain because of inability to procure these medications. They were not in the first place forward about taking medications, not to talk of when they have financial investment. So that's a huge problem. However, as clinicians and health workers, what we need to do in this instance is there are actually some brands that are cheaper than the generics. So those brands can be alternatives. You can use that and then monitor the patient closely when you start that newer brand to ensure that there is good control. Again, our health insurance system, the government should strengthen our health insurance system such that patients don't pay out of pocket most of the times. Because that's the major problem. In other climes, this is done. Government is doing, started doing something, but they should do more in this regard so that people will be able to afford their antihypertensives.
So the insurance can contributory or non-contributory, whatever it is, there should be coverage for as many people as possible, so that you don't. It's not when you fall ill, you start to sell your property, sell this, so that the person can get well. It's in fact that such a person will not get well, even if it will recover in health. What
how does it get continue?
Yeah, standard of living. What of living is normal life is used to. And it's so that is always a problem. Well, I think we need to draw the curtain at this point in time.
Thank you very much.
Thank you very much. Members of the Nigeria Hypertension Society, led by Dr. Julius Edeogu. We also have, thank you very much for coming. We also have the Dr. Dodiyi-Manuel, who is a consultant physician cardiologist. Thank you for coming.
Thank you, sir.
And Dr. Bunmi Ajala, a consultant physician cardiologist. Thank you very much for coming.
Thank you very much.
Yes, there is much we can take for today. World Hypertension Day, 17th of May, 2024. Please remember to subscribe, share, and like. Thank you. Bye for now.
Thank you, viewers. Know your numbers.